Professor Margaret Kobia. Good morning, Prof. And even as we look at the announcement by the President, and of course the voices of Kenyans saying, some of the Kenyans saying that they are already receiving it, I know it's not squarely under your ministry, but you might have a word to say in as far as identifying these people. What can you tell us about the status of the stipend, weekly stipend, and how exactly you will be identifying the vulnerable people in the community?
Thank you, Sam. First, let me start by thanking you for inviting me. Sam, when this country got into this health crisis, the government, led by His Excellency the President, sat and put a plan, because to be able to confront this magnitude of a problem, there needs to be a program and a plan that the government can implement, and when we implement, we'll be taking care of our citizens. The government has already complied with or is already asking the citizen to comply with the measures given by Ministry of Health, that is washing hands with soap, wearing a mask, social distancing is very, very important, and staying at home. For that reason, quite a number of people who are daily wage earners have been affected in the sense that they cannot go to work and be able to earn their livelihood. That's why the government has come up with a social protection program where the households have been mapped out so that they can be able to get a weekly stipend that they can use it for buying food and the other necessities depending on their needs. And I think the social protection program where there are cash transfers is more dignified rather than just distributing food, although in some circumstances where you're able to distribute food, that can also happen. That's the plan the government is rolling out. This week, we have been doing a pilot, because it's very important to do a pilot, and this pilot involved getting data of the households from assistant chiefs, Nyumba Kumi. They are the ones who will be able to identify those people in the slums who are living, who might be affected by this corona crisis. After the pilot, that is giving them about 1,500 per week, then we'll be able to get feedback. How many will be able to get this money through cash transfers, and that feedback will be used to improve the program. Some, in this country, we have about, if you look at the Kenyan Bureau of Standards, we have about 16 million Kenya who can be described poor. That means they live below $2 a day. But at this time, we might not be focusing that. We are focusing those who live below 50 shillings a day. And that's when data can be reduced to something between 3 million to 4. And in the sense that already we are giving the social protection program is already having about over 1 million. That is the elderly, over 70, vulnerable, those who are severe disabilities, and also the orphans. So about 1 million is already receiving about 2,500 every month. That program has gone on very well. Of course, sometimes some people say they have not been reached by that program, but I think that 1 million is already taken care of. The remaining 3 are now in the slum areas, in the counties, because counties are also endowed differently. The government will be able to map out, and after the pilot, next week, as the President says, then the money will be distributed, and the money will come from the KT, where the fund, you remember there's a COVID fund, and also the government is also putting in some money. Therefore, as a way of really confronting this crisis and taking care of the vulnerable, because that's what government are about. They're about taking care of their people. I think we should be, it's a good program that I think we should be able to ask all Kenyans really to come forward, see the assistant chief, see their Nyumba Kumi, if they feel they are left out, so that they can be included in the program.
Okay. All right, we'll shortly be talking about the transparency of the program in as far as the measures you put in place. But first, before you do that, so I look at the figure you're talking about, over 1 million people already receiving this support from the government. And when I was looking at the numbers from the Ministry of Labour and Social Services, you're talking about just slightly above 1 million, and each has been getting 2,000 shillings every month. So cumulatively between January and now, that will be 8,000 shillings that will be disbursed to them. When I look at the figure, you talk about 1,500 every week. That's an average of 214 shillings per household per day. How did you make this estimation and calculation to determine that this could be sufficient to feed a family of, I don't know what the average size of the families that you're talking about is. How did you determine that it's sufficient?
Thank you, Sam. To determine the number of household, I think I said they are mapped out through Assistant Chief, but then we also estimated, according to the Kenyan Bureau of Statistics, how many people live in every household. We say that at approximately 4. And if you are to look at what already is out there, 2,000, and for individual, what about when they are about 4 in every household? That's why we came with an estimate of 1,500. Okay. And that's why it is a pilot, because we'll be able to get the data, how that worked. And what needs can, if depending on if the government is going to get more resources, it can increase. And if the needs, because we don't know how long we are going to be in this journey, it could be around maybe that 1,500, or they could even go a little bit higher. But it is estimated every household has got an average. That's an average of 4 people.
4 people per household. So, how sustainable will this be? Because yes, the president saying that this program has already started in Nairobi. I am suspecting that should you now stretch out to the rest of the country, you have so many numbers. How sustainable is it, and how much money are we talking about in the long run?
Thank you, Sam. I think sustainability is also is a question the government is putting on the table, and the government is not working alone. This is one crisis that we require the private sector, the civil society, and everyone to come in, because when you are going to a war of this nature, the government alone cannot be able to overcome the problem. That's why everybody will be called on board. There are various development partners are coming in to raise some money, private sector. And then depending on the data that we continue to see in this country, we will be able to know how long this is going to continue. Because to tell you for sure, we don't know how this coronavirus is going to be with us. It's a global problem. Especially in Africa, it has just started, and we can see a situation that if we don't really comply with the measures, maybe it's just starting. It can hit very hard. But taking care of our vulnerable societies, that's why government exists. So sustainability is on the table. I do not have a clear answer right now. We have started with 1,500. If moving forward, if we are able to raise more money, then we are able maybe to maintain it at that. And that's what the pilot study result will be telling us. But sustainability, if we are going to go for 1 year, I think that can be sustained. But if it's going beyond 1 year, I think they will have to come back. That's why the government plans and see what are other sources. And also, I think we also start appealing to Kenyans that out of this difficult situation, there are also opportunities. Where people are not just going maybe to sit at home doing nothing, they will really become innovative. And you can see that's why government has opened small little businesses, so that within the time frame of the curfew, they can be able to go to their barber shops, salon, their shops, and be able to continue with the businesses. And that's why in Kenya, in our context, we may not just close down just like that. It's a systematic, phased-out approach, and informed by the data that we are seeing and the results that we are hearing from the Ministry of Health.
All right. As you respond to the question about transparency, because historically you've seen, yes, the same, if I may call it the provincial administration you're talking about, you've seen some inconsistencies in as far as people that are vulnerable are being identified. I don't know what model you'd be using to ensure that only the deserving cases are assisted by the government. But even as you look at that, how then are you encouraging the affected not to become dependent, but also to continue doing something that can be self-sustaining?
Thank you, Sam. I think being able to identify accurately in an objective manner those who are extremely poor and then support them, I think is the way forward. But at the same time, no government would want to see its citizens become too dependent on some kind of a free gift. But I think it's because of the situation we find ourselves that we kind of support them while they are thinking how else will then be able to become useful and generate some income. I'm thinking that this challenge is not challenge which is at least forever. Opportunities are going to arise, and being able really, because we are saying it's not only the government that's identifying these vulnerable people, they're extremely poor, because this country cannot be able to solve all the problem of the 6% of the Kenya who are defined as living below $2 a day. But we can be able to deal with a small percentage like 4 million for the time of dealing with the problem. Okay. Therefore, what the government is doing is saying community leaders are identifying, that's why we have Nyumbakumi, these people, so that you know in your community where you live, in your neighborhood, who is the most poor person. Okay. The assistant chief, and actually the people should also be transparent and come out and say, we know somebody who is getting this money, yet they are not extremely poor, while somebody else is left. You have seen like in Kibera, where there are quite a number of people who have been doing their own businesses and they have been able to earn their livelihood, and some of them are saying they have still not been reached by that program. It is true, may not reach everybody, but we are trying to reach whoever cannot afford a meal a day. That is the person who want to make sure at least they have 2 meals a day, at least a breakfast and a dinner. And that number, I think that's what we are approximating between around 3 to 4 million, taking into account the 1 million is already taken care through social protection safety net with the Ministry of Labor.
All right, Prof. And under your ministry, there is the very important question about the young people, and of course, talking about the gender issues. So there are several young people that are struggling with their businesses, and they may not qualify for this stipend. So what do they do to ensure that their businesses remain afloat despite the challenges that we're facing currently of reduced disposable income, and at the same time the curfew hours that are also limiting their access to their workplaces, and even the cessation of movements in the 4 counties, including Nairobi?
Thank you, Sam. I think the crisis we are facing has affected both men and women. But we see that women have been more affected in the sense that most of the 60% of the people who have lost jobs, 60% are women because they're in the informal sector, and they are also in sectors that have been affected by this crisis. What they have been able, we are kind of supporting them to do is to make sure that those who get small little loan from Women Enterprise Fund, that it's for their businesses, because they are the same who are also earning daily wages. We are kind of considering either allowing them 3 months, maybe not for their loan repayment break, so that they can be able to kind of recover. The other also women who are saying that even in their difficult circumstances, they still within the curfew hours, they should also be able to continue with their businesses so long as they practice social distancing and they wear a mask. So we are not saying that they close completely, but you can see government has come up with a program to make sure they are supported. And within the programs that the government is offering, I think they should also have a voice to be able to say what problem they are facing, so that they can those issues can be addressed, and they continue being able to feed their families, because when women are not able to feed their families, it becomes very difficult. Let me just say what especially young women who are in the youth can do. This crisis also brings a lot of opportunities of what can they do. One, they can already start advocating, working with other civil societies, wherever they are, to find some opportunity to preach how the youth or young women should keep themselves safe during this crisis. They can also get into social media that really reaches most of the youth people, so that they can be able to find online jobs. Quite a number of people are finding online jobs which they could be able to earn an extra living. So I think this crisis has brought another opportunity, or see what other businesses, what other opportunities people can look into if they become innovative. So that, for example, women have always wanted to work from home. This crisis has presented an opportunity that with support of maybe internet, with the very clear what the jobs are available through the Ministry of Youth and Digital Jobs, I think quite a lot of young youth women could find opportunities so that we all don't sit back and hope the government is going to provide all the solution. But this is a crisis that is calling for everyone to have their hands on deck so that we can be able to pull through.
All right. Prof, as we begin to wind up, so there's the question of the gender-based violence. I remember sometimes last month, the Chief Justice David Maraga said that 30% of criminal cases coming to the courts are related to sexual offenses and gender-based violence. We've been listening to bodies like the United Nations Population Fund saying that during pandemics, there are cases of gender-based violence. I don't know, from your ministry, how many cases have you been receiving since the COVID-19 reached the country, and how are you trying or responding to the calls and, of course, protecting the people that are victims of GBV?
Thank you, Sam. The question of domestic violence has increased since the crisis. And this is not just in Kenya, it's globally. I think it has been reported that almost gender-based violence cases has raised to almost 40. In Kenya, we see in January, we had around 50 cases. In February, we had 62. And in March, we had 106, an increase of almost 40%. And in this month is already over 115. That is, and the month is not over. Because what it means, let me flag out that with the requirement of staying at home, children have closed school, and everybody is at home. I think so much pressure and stress has been put on within the household in terms of provision for food, and also even people worrying how is our education going to be, what is going to happen tomorrow or the next month, and the fact that there is also an increasing unemployment. Then we find people are very stressed. And that's why the government is trying to see if you help them with basic needs like food, perhaps the gender-based violence could reduce. Because we are finding a situation where men are being blamed for not providing. We are also finding women where they are saying the chores have increased. So everybody is stressed out. And that's why my ministry is already coming up together, partnering with the civil society, Ministry of Health, to provide some psychosocial support where there is counseling and mental health effort to help people go through that. On the other side, we are also finding that these cases, when children at home, defilement has increased. And I call upon parents to make sure that they look after their children when they are at home. Because most of those defilements, as pointed by DPP, are done by people who are known to them, their relatives or the close neighbors. So this is an opportunity to take care of our daughters at home so that they don't fall into the danger of defilement or any type of gender-based violence. And that's why we have in our ministries, in the Department of Gender, we have a helpline. The hotline is 1195. Anybody, that's where we get cases of gender-based violence. We would urge Kenyans to report any incident because right now, besides reporting to police station, which I encourage, there's a gender desk. But at the same time, the 1195 helps you with information of where, if you experience gender-based violence, where do you report, where do you get help. And in severe cases, we have safe houses where women or anybody who has experienced gender-based violence can be evacuated to stay there while they are seeking either legal help or medical help. So it is very important that I call upon families, households, civil society, churches to come up with knowing that gender-based violence has increased by an average of 30%, and it's about time we also confront that problem because it's an intended outcome of social distancing by staying at home. Then we find homes where we are supposed to be safe, they are becoming an unsafe space. Thank you, Sam.